Welcome to H.R. 519, the Tax-Free Health Insurance Act of 2019 by Alicia Royce. What is Bill H.R. 519? H.R. 519 is the bill to amend the Internal Revenue Code of 1986, more commonly known as the Tax-Free Health Insurance Act of 2019. Can the government demand tax on health insurance premiums paid? The answer is yes, they can, but they do not. This new H.R. 519 allows tax credit on health insurance premiums that are paid for the taxpayer, for their spouse, and also for their dependents, not mattering whether they itemize or not. So it's giving an open window to taxpayers, allowing the premiums they pay to be deducted on their taxes. Is an individual more likely to buy health insurance when there is a tax credit? The short answer is yes. So what does having health insurance mean? Having health insurance is an overall contributor to an individual's overall health, being physically and financially healthy. So H.R. 519 is a legislative bill that allows the tax deductions for the health insurance, and that's on anything that constitutes medical care. The taxpayer is getting credit for the health insurance premium that they paid. People who don't get health insurance provided by their employer have to go out and buy their own health insurance. This tax credit is a financial incentive for them to go ahead and have health insurance. This tax-free health insurance bill is solving the problem, or helping solve the problem, of unaffordable health care. It's promoting individuals to obtain health insurance, which contributes to their overall financial health. This issue is addressing issues that also relate to the Affordable Care Act and helps to reduce the number of Americans without health insurance. It's promoting more individuals to obtain health insurance, and there is a research study that proves that. And having health insurance contributes to overall health and well-being. H.R. 519 Tax-Free Health Insurance Act is a policy in the making. This Tax-Free Insurance Act has currently been introduced. It has a committee, and it needs to go through the House of Representatives. If policymakers continue to support this bill, it'll move through the Senate to the President and become law. The committee that the bill is on is called Ways and Means. The current sponsor of the bill is House Representative Steve King. He's the House Representative of District 4 in Iowa, and he has 5 co-sponsors. Nurses have a role in promoting this proposed legislative bill. They have the power to advocate and inform lawmakers to help support this. It has been introduced. It still needs to be passed. It sits on the committee with its sponsors. There are no opposers. And once it gets more support from all the representatives of the House, it can move through Senate and become law. It's important that HR 519 becomes a law so that we can depend on this tax credit for health insurance premiums paid. It has a big economic impact. So when premium tax credits are available, it's providing payment support. And the number of individuals who purchase health insurance increases. A study by Hindi in 2016 mentions that this tax credit benefit being available to everyone and not just those covered by their employer health plans widens the range of individuals who are getting credit for insurance that they pay. This is a positive economic impact and encompasses everyone and not just people who are employed. The health insurance is a huge health determinant. Whether or not someone has health insurance makes a huge difference on what services they can have as far as needing medical care. The fact that having health insurance is a determinant has been proved by Desmond and others in 2016. When there's a tax credit, individuals are more likely to go out and get health insurance. This is important. This could mean the difference in quality of life for someone. And it's interesting that research by Desmond and others in 2016 proved that 50% of their studied participants qualified for Medicaid, which is a public health insurance versus a private health insurance, but only 35% of those who qualified actually applied. So this tells us there's a gap in knowledge and education to where individuals who could have health insurance simply don't. So we need to implement HR 519. This has implications for research, education, and nursing. The implications for research are going to prompt policymakers to look into the cost and fluctuation of health premiums. They're going to be able to look at who is qualified and who's not utilizing premiums. They can also compare individuals who need to have health insurance versus who is actually able to pay. That is going to be a huge indicator on who is needing this insurance and who is not able to pay, which I think will be important to know. Implications for education are studying the other impacts of the Affordable Care Act on related healthcare costs. Once this law is established, we can depend on the fact that everyone is going to get tax credit on health insurance premium. So everyone should be able to pay for their health insurance with a financial incentive. They should be able to get health insurance no matter what. This is a spearhead on what other things the Affordable Care Act is dictating. For nursing, the established law will help us guide patients, and it will definitely help us provide comprehensive care that we can depend on this law and educate our patients on obtaining health insurance. Nurses can consider health insurance in being a huge factor to when they're receiving care, because it is a consideration we need to make, and it is a big deal to the patient. We don't always see that when the patient comes in, but it does matter when we are taking care of a patient. They have a huge financial consideration, and financial impact can have a psychological effect on our patients and their stress levels. So nurses need to take that into consideration. When nurses can depend on health insurance policies, the gap to gaining access to care begins to be filled. We need to be able to tell our patients there is hope. They can have access to health care, that they can have health insurance at lower costs. Takeaway ideas: tax credits mean more individuals purchasing healthcare insurance. Healthcare insurance is better access to healthcare and better affordable services. The tax credit law also helps nurses engage and consider comprehensive care when evaluating and reassessing outcomes, especially. And the health insurance tax policy ultimately contributes to overall better health and promotes healthy people. So inform your lawmakers on Bill H.R. 519 and support it, and support lawmakers in making H.R. 519, the Tax-Free Health Insurance Act of 2019, one of our federal laws. Thank you for joining this presentation, and have a good day.